Hello, everybody, and welcome back to the second episode of the NF podcast. I'm Klaas Röhl, the founder of NF Patients United and the head of the Austrian patient organization NF Kinder. I have a daughter who was diagnosed with NF1 when she was just a baby, and that's how I got involved. I wanted to start a patient organization in Austria, and I also founded or co-founded NF Patients United to bring all European patient organizations together. In our first episode, we sat down with Matt Boltz-Johnson from Eurodis to talk about his important work in mental health. A really insightful conversation. Today, we're excited to welcome another specialist, Professor Ignacio Blanco, a clinical geneticist from Spain, who will share his expertise with us. Welcome, Ignacio.
Hi, hello. Thanks to invite me to have this conversation. Thanks.
It's always a pleasure to talk to you. Ignacio, you work as a clinical geneticist in the Germán Trias Hospital in Barcelona. You completed your residency in general and digestive surgery at the Sant Pau Hospital in Barcelona and completed a research fellowship in medical oncology and immunotherapy at the University of Nebraska Medical School in the US. You are board certified in general and digestive surgery and are accredited in the human genetics by the Spanish Society of Human Genetics. So you're both a surgeon and a geneticist.
Yes, that's true.
That's a rare combination. How did you find your passion?
When you start thinking why you decide things in your life, this is always difficult. When I was in the medical school, I was very anxious to find answers to all the questions that any patient could give me. The first time I thought that surgery will be the best way to address these problems because you go right away, you cure the patient, and that's all. But when I finished my residency, I moved to the United States, as you say, to learn more, to know why patients have diseases. And I was lucky to be in the United States with an important person for me that was Dr. Henry Lynch. He discovered the Lynch syndrome, and at that moment he was studying hereditary pancreatic cancer. And I found her and him, and I was so happy. I was so amazed about genetics, about how talking with patients, you can help them. You don't need to operate them. You have to be with them. And I learned a lot from him. And then when I come back to Spain, I decided to dedicate to genetics. The first years was a mixture. I was practicing surgery and at the same time trying to introduce genetics in Spain. Was in the 1990s, 2000. And at the end, I decided to move totally to genetics, more to rare diseases. And I mix, and I was happy to find other guys here in Spain, like Conchi Lázaro, Edu Serra. They introduced me in the world of neurofibromatosis. And that was the way.
I remember my very first European NF meeting I went to. It was here in Barcelona. It was when I first met you. What makes genetics so fascinating to you?
Genetics is a very new knowledge, new science. There are a lot of things to know that you can improve things learning at the same time. And for example, 20 years ago, there was no possibilities to perform genetic tests. Right now, we're performing genetic tests. And I'm sure that in a few years, we will learn a lot more. It means you have a lot of space to improve and to learn, to study, and it's so challenging. Every day you have to be studying with genetics. It's passionate for me as a doctor.
And you mentioned that genetic testing is now so very much available in routine care as well. And this really changed how you could identify carriers of genetic tumor predisposition syndromes like NF, correct?
Yes, we have this opportunity now, but we have a lot more to do, because right now, when I met a patient with NF, I can make a genetic test and to find the pathogenic genetic variant responsible for the disease. But I'm not able to explain to the patient what will happen in a few years. I'm sure that in the next years, we will learn more about modifier genes that will allow us to make a better prognosis of the patients. And this is what I'm so excited about genetics, because every day is different from the other one. And you can find different ways to better treat and manage patients. It's an amazing world.
NF, of course, is also a genetic disease. Let's maybe look a little bit into the history of NF. When was NF first discovered and by whom?
Okay, there is some debate in the literature. Everyone recognizes now that Dr. von Rickenhausen was the first one who wrote the history of 2 patients with NF. But some other professionals, doctors, talk about neurofibromatosis just before him. However, von Rickenhausen is the first ones that write about neurofibromatosis in 1882. It's yesterday. However, I don't know if you read in the science paper that someone has found that possible in the primary years there were already patients with NF. The problem is that doctors were not able to recognize the disease, but the disease has been with us forever. Now we know von Rickenhausen was able to describe 2 families, patients, and start the history. Since then, many other small achievements has been in the way improving what we already know about neurofibromatosis.
That is true. There's still, it is a very unpredictable disease with a large variation of symptoms, sometimes even within the family, that a parent can have a very mild case, while the child with the exact same mutation might have a very severe case. You mentioned modifying genes. What are the explanations for this large variability in NF1?
We are trying to find the explanation. We don't have a total clue of that, but I'm sure, in my opinion, that there has to be gene modifiers and environmental modifiers, both things. Patients that are born with pathogenic genetic variant in NF1 have the risk to develop the different symptoms. But that patient has more than 2,000 genes that can modify the way that the pathogenic variant is acting. And also the patient is surrounded by an environmental system, diet, the way that he's teach, how is his race, whatever, that can make an explanation of this changing, this variability. Because, as you say, there are not 2 patients that are equal. Every single patient is different.
You mentioned that genetic testing has become more and more important, and a good sign how important genetic testing is nowadays is that it was also added to the diagnostic criteria of NF1 in the recent years. Why is it so important to diagnose patients as early as possible?
This has been also a huge debate here, for example, in Spain, because if you diagnose a patient with NF1 3-4 years earlier, there is no real change to the patient. However, we have to be in the place of a parent that has a child with 6, 7 cafe au lait spots, nothing else. And we as a doctor, 10 years ago, 15 years ago, we say, okay, we have to wait until 8 years. And if nothing else happens, your child will be okay. If something else happens, the child will have an NF1. Then we have to help families to know what is happening with her child. And for me, this is one of the good reasons to introduce the genetic test in the early stages. If we perform a genetic test early, we can help parents to copy with the diagnosis. And we will be able to say to the parents, yes, your child has an NF1. We won't be able to say if it's worse or less worse, but we will prepare a preventive plan. We will perform a surveillance program that will help us to identify the different problems as soon as possible and trying to reduce the impact of these new manifestations of the NF.
That is very important what you just mentioned, to start following up with the patient and performing routine tests, like example ophthalmologic assessments.
Exactly.
Because we now know that every 5th child develops optic pathway gliomas between the age of 2 and 8 years. So if we wouldn't be able to have genetic testing, usually children, I would say 20 years ago, were probably diagnosed not within the first 3 years of their life, but probably when there are 2 or more other diagnostic features besides the cafe au lait spots. So maybe already during the critical age of optic pathway gliomas.
Yes, you're right. That's the opportunity. We can start a real preventive program as early as possible. That's important. Mm-hmm. However, someone can tell you that, okay, you're right, 1 of every 5 children will develop a glioma, but probably if you are a good doctor that knows about NF1, you will be able to identify these patients early enough. I will say, okay, we have to standardize the way that we deal with patients, and having the genetic test as soon as possible help us to identify patients at risk and make clear decisions about what to do.
Since NF is a genetic disease and all the symptoms manifest because of the genetic variation, gene therapy is the future or the big hope for many NF patients, that there will be a cure one day, because at the moment doctors are treating the symptoms but not the root cause. How do you think will the future of NF treatments look like?
As you can imagine, as a surgeon, when I decide to deal with genetics, I say, okay, I will operate genes and not patients. I've been trying to be or to have all knowledge about genetic therapy in these years. Everyone thinks that a genetic disease should be cured by gene therapy, but this is not easy and it's not probably possible to everyone. When I start dealing with genetic diseases, I was very happy with gene therapy. Then I went down to the hill because I say, okay, this doesn't work. Right now, we have new knowledge that is increasing the possibility of gene therapy. We now have tools to modify genes. We have tools to send genetic information to the cells. We have tools to improve the production of proteins. And we are hoping with this gene therapy. I also want to be clear the moment where we have to perform the gene therapy is critical. If we are dealing with a patient that has already many manifestations, it will be difficult to remove all these manifestations that has been done. Probably gene therapy will be efficient for some manifestations, or more efficient if we treat patients very early in life. Gene therapy is a dream. I think that is a hope, not a hype, but we have to learn a lot still in order to be in place in the treatment.
I learned that the NF1 gene is the second largest gene in the human body. So does that make it also more challenging to correct the gene that is that big?
Yes, you're right. This is one of the biggest one, and it's difficult to correct. But right now we have other ways to overcome the problem that the gene has. Right now, for example, we can modify the area of the gene that is read. This means that you don't need to correct the exact point. And also you can introduce a complete RNA that allow the cell to produce neurofibromin. There are different ways. To me, the more important problem is that we have to treat all cells of the body. That's very, very, very difficult. It's not like, for example, in hereditary diseases of the eye, where you only need to treat the retina. In NF1 patients, you should treat all cells of the body and modify all cells of the body, or to be able to be sure that you will introduce neurofibromin in all cells. It's very challenging.
I imagine that must be very challenging, very tricky. Some gene therapy approaches use viruses to carry the gene therapy drug to the different cells, but I learned that it still doesn't read every part because of the blood-brain barrier, or what's the explanation for that?
Yes, because it's a virus. The virus is not able to go through the different barriers that we have. If the central nervous system has a barrier, in order to avoid toxic products to reach the brain, and the DNA, the virus, is too big. But you have to reach also all peripheral nerves. That's very challenging. You have to reach all the stroma in the gastrointestinal area. Means it's difficult. I wouldn't say no, but it's very difficult. And also imagine a patient that has a plexiform neurofibroma, that has already starting to develop to premalignant lesions like an anup or to a malignant tumor. These cells has already acquired different genetic alterations. You can modify the first one, but if some other alteration has been already acquired, the treatment is not helpful. For that, we have to look for different ways to introduce gene therapy, but it's not an easy procedure.
So there's still a need for much more continuous research to be performed, hopefully also public funding to go into this area, as about, I think, almost 80% of rare diseases have a genetic cause. So any advancement in this area would benefit many, many different rare diseases. Right?
Exactly. And also we have, as a society, we have another challenge. Because, as you say, 80% of the rare diseases are genetics. But every patient has a different genetic barrier. This means that you have to deal with a different treatment for each patient. You cannot find like an aspirin for all NF1 patients. you should perform a genetic therapy for each different patient. And this is very, very expensive.
So this is personalized medicine at its best.
Yes. And you introduce a new term that is personal medicine, and any doctor will say, oh my God, I always doing personal medicine. It's now a very interesting area where we have to perform personal medicine, but also precise medicine. Both. The new doctors are dreaming with precise medicine. We will be able to treat every single patient with with the best way and the best treatment. But you should not forget about personalized medicines. You have to talk with the patients. You have to know every single patient. You have to know how the patient is feeling with his disease. You know perfectly, with being a parent of a patient with NF1, that every patient is different. You can find patients with thousands of neurofibromas that are okay. They have been able to cope with the disease. But then you find a patient with a single neurofibroma, and the patient is scared, or you have to talk with the patient. You have to know how the patient is feeling, how the family is feeling, and then you will apply also this precise medicine.
Thank you so much, Ignacio, for talking to me today. It was super interesting, and thank you for all the contributions you have made to NF patients and caregivers.
Thanks to you. Thanks.
This was part 1 of episode 2 of the NF podcast. I hope you all enjoyed it as much as we did. Again, if you have any questions or feedback for Ignacio or for me, feel free to write us on any platform. You can find our contact information in the show notes. Thank you for listening, and until next time, where we will talk about genetic counseling and exciting research projects. So tune in, and bye for now.